48-year-old executive present to the emergency department because of chest tightness and a shortness of breath. ECG shows ST elevation in the lead V4, V5 and V6. He has a history of the high blood pressure and his father died of the cardiac problem at the young age. Assuming no other cardiac history, which of the following myocardial abnormality would most likely to be seen under the light microscope 8 hours after his symptoms begin? So pick the point that is important, that is the patient suffering from the ST elevation. It means ST elevation, that the patient has myocardial infarction. In the lead V4, V5 and V6 is mean the infarction start, or the myocardial infarction start at the anterolateral position of the heart, and he has two history and two risk factors for causing of myocardial infarction. Number first, that is the high blood pressure, hypertension, and number second, the family history. Assuming no cardiac history, so which one can seen under light microscope at the 8 hours after the acute myocardial infarction? So this man has suffered from so we understand the whole scenario, that the man has suffered from myocardial infarction. He demonstrated 2 of the 5 important risk factors for developing the heart disease, which including the hypertension, hyperlipidemia, tobacco use, diabetes and the family history of the heart disease. But this patient has only 2, that is hypertension and the family history. The changes that occur in the affected cardiac tissue can be helpful in assuming when the infarction occurred. So all these changes which help us that what is the duration of the acute myocardial infarction. Okay, during the first day after acute myocardial infarction, the affected tissue begins to undergo coagulative necrosis and releases the cardiac enzyme like troponin 1 and CKMB from the because of the dying of the cell. The cardiomyocytes start to die. Coagulative necrosis is marked in the early stages by preservation of general tissue architecture, with myocytes becoming increasingly eosinophilic. The contraction band will also be seen, so causing the myocytes to take on wavy appearance. So the first the sign which appear, okay, if you look the first one, that the contraction band start to appear under the light microscope after the 8 hours of the acute myocardial infarction. So our option should be this one, that it occurred after 8 hours. And about the granulation tissue and the monocyte infiltration, they mostly occur with the same time, because the granulation tissue is mean that the new blood vessels start to form, fibrosis start to form and vascular proliferation. So these processes, these morphological changes we can see after 5 to 10 days after myocardial infarction. Okay, so after 5 to 10 days, and monocyte infiltration is somewhat like nearly 5 to 10 days. Okay, and neutrophil infiltration, it is the sign of the acute inflammation, and it's happen during the acute inflammation of the cardiomyocyte, and it appear usually 12 to 24 hours when they start dying of the cell. Okay, that's why first 12 hours is very important for the patient suffering from cardiac infarction. So no changes can seen within 2 to 4 hours. Within 2 to 4 hours we cannot see any change. Okay, thank you.